Hi everyone, it's Dr. Ying Qi with Orange County Hand Surgery. Welcome to another episode of In Good Hands with Dr. Qi. Today, we'll be talking about do's and don'ts after hand surgery. Do keep the surgical site and the dressing clean and dry at all times. It takes your skin 10 to 14 days to heal the incision. So if the water seeps in before the skin is completely healed, the bacteria can track into the incision and cause a potential infection. Do ice and elevate your hand as much as possible after surgery. Swelling is very common after surgery, so by elevating your hand above the level of your heart and ice around the surgical site can greatly reduce swelling and reduce pain. Sometimes the swelling can come in after surgery and dressing becomes a little tight. So it's always wise to check the dressing. If it's too tight, you can always loosen the first layer. Do consider a stool softener and keep well hydrated while taking pain meds. All pain meds potentially causes constipation, so it is a good idea to take some stool softener while you're taking the pain meds. Do call your doctor's office or visit an urgent care if your pain is not controlled. Patients respond to pain medications differently, so the doctors can always change you to a different type of pain medication. And also, the wound can also be inspected at urgent care or doctor's office to make sure everything looks okay. Do start scar massage after the stitches are removed. Scar massage, best with coconut oil, really will help the new scar formation and reduce the sensitivity around the surgical scar. Don't smoke tobacco or cigarettes after surgery. The nicotine in tobacco or cigarette can cause increased risk of wound infection and delay wound healing. Don't soak your wound in water until your stitches are removed. Surgical wound needs time to heal and become watertight. So before that, we want to keep it clean and dry. Don't lift or do strenuous activities right after surgery, especially with the hand that was just worked on. Now, excessive pressures over the incision can cause delay in wound healing, sometimes can even cause the incision to open back up. Excessive use of the hand or wrist can sometimes cause the cyst to reoccur. Don't take the dressing down unless it's instructed by your surgeon. Everything inside the dressing is sterile from the operating room. The wound needs to stay clean and dry inside the dressing to allow proper healing. Don't ignore warning signs, such as excessive bleeding from the surgical wound. That needs to be assessed by either your surgeon or at an emergency room or urgent care. Also, prolonged numbness in the hand and fingers for longer than 24 to 48 hours because normal numbing medication lasts about 24 hours or so, so you should start feeling the numbing medication wearing off after 24 hours. If your hand stays numb longer than that, it's probably time for a visit at your doctor's office. Next warning sign would be swelling and pain that's not controlled even with elevation and ice and pain medications. If that's the case, many times the dressing needs to be assessed to make sure that the dressing or the cast or the splint is not too tight. And if it is, that needs to be adjusted accordingly. This concludes another episode of In Good Hands with Dr. Chi. Be sure to subscribe to our YouTube channel, follow us on social media, and visit us at ochandsurgery.com. See you next time.